Documenting brief respiratory assessment. When a resident complains of shortness of breath, your assessment is performed based on your resident's chief complaints and your observations. A resident may complain of pain when coughing, shortness of breath, dyspnea, nosebleed, hemoptysis, or wheezing. You should look for signs of respiratory distress such as nasal flaring, facial grimaces, and audible wheezing. Also make note of the resident's level of consciousness such as lethargy, increase in anxiety, agitation, confusion, and irritability. If your resident complains of coughing, assess if it is dry, or productive, or severe, and the color of the sputum. Was there any activity associated to bring on the cough? Is blood being coughed up? Dyspnea. Did it begin suddenly or gradually? Is it present when sitting up and or laying down? Hemoptysis. Do you cough up blood? Is it mild? How long? When did it begin? Wheezing. Does resident have asthma or allergies? Are they experiencing chest pain? Is it caused by certain position? Is airway obstructed? When assessing your resident, observe skin color if it is pale, pallor, cyanotic or sweating. Check their mouth also for obstruction. Obtain a complete set of vitals, temperature, pulse, respiration, blood pressure, and pulse oximetry. With your resident sitting upright, auscultate their lungs for normal and abnormal breath sounds during inspiration and expiration. Make note of adventitious lung sounds, such as rhonchi, a low-pitched, loud sound heard on expiration. Rales, a soft high-pitched popping or crackling sound heard on inspiration. It has a similar sound of rubbing hair strands together close to your ear. Wheezes, a whistling type noise produced when air is forced through narrowed airways. It is heard on expiration and sometimes inspiration. Stridor. It is heard on inspiration when there is an obstruction in the upper airway. Pleural rub. Is heard when there is inflammation of the long pleura. It sounds like leather being rubbed together and heard on inspiration or expiration. Check residents' MAR for respiratory-related diagnoses. Be sure to have all your assessment findings completed before calling the doctor. Here's an example of documentation of abnormal findings. Resident complained of shortness of breath for 2 hours. He states he has a hard time breathing and said, "I coughed up some greenish stuff." Nurse observed nasal flaring and facial grimaces. Labored and pursed lip breathing was noted at res. Pulse oximetry 89% on room air. Temperature 97.2, pulse 100, respiration 30, blood pressure 160/90. Resident is alert and oriented ×3. Skin color pallor and diaphoresis noted on face and neck. Nurse observed intermittent productive cough and coughing up blood-tinged green sputum at times. During auscultation, rhonchi noted in bilateral lung bases. Wheezes also heard throughout lung fields. Thank you for watching and please subscribe.